This is going to be the kinesiotaping technique for the shoulder, and we're going to be decreasing pain and increasing function of the shoulder with patients who have disabilities, so especially with any overhead athletes. There is no definitive exact reason of how the kinesiotaping is working, but one of the main leading thoughts is that it's more of a neuromuscular, maybe even lifting the skin mechanically, which is then going to change the signals from the brain and skin to from the skin and the muscles to the brain, allowing for pain-free motion.
All right, so this is going to be the kinesiotape technique here. So our first strip is going to be a Y strip, like so, and it's going to be applied with the patient side bending to the opposite side that we're applying the tape, and then internally rotating the shoulder as if reaching into their back pocket. And so the bottom of the tape is going to be, so we're just going to kind of follow the origin and insertion of the supraspinatus muscle. So we're just going to do paper off tension. And so we're just going to go like so, if you want to turn there so they can see that. So it's going to be a Y strip, like so, and then they're going to come out of that motion. And then we're going to do the deltoid. So you have them abducted and externally rotated. You start at the insertion of the deltoid on the lateral side, and then this is going to be the anterior strip. And so you're going to place that and then around the outside of the previous strip from the supraspinatus, and it's going to be also paper off tension, like so. And then for the posterior strip, you're going to have them reaching internally rotated, horizontally adducted, as if reaching into the other pocket. And this one's going to come around this way. And again, paper off tension with that. And then the last one is going to be, we're going to be pulling at 50 to 75% of its stretch, and the patient is going to be going into flexion, external rotation, and then into shoulder flexion. So we're going to start on the anterior side when they're in external rotation, and then we're going to apply that 50 to 75% stretch and apply it as they go
into flexion
of the shoulder and adduction of the shoulder, like so. And so if you want to show them how that looks, like so.
Yep, and then of course at the end of it, you're always going to recheck your motion to see that they did increase the amount of pain-free motion and function of their shoulder after the taping technique.
And then with this taping technique, you can also round the tape so that it stays on a little bit better, so it doesn't roll off, because this tape can be used in water, so they can shower and do all their normal daily activities while wearing this, and it's usually left on for 3 to 4 days before they need to be come in and have it reapplied.
Yep. So this would be the rounding at the edges that I did have on other tape previously. So just rounding, cutting the edges.